Let's move on. About 7% of women are affected by ovarian cysts at some point in their lives, with the condition mainly manifesting among women of reproductive years between 20 to 40 years. Doctors say that in many instances, the condition comes by chance with no telltale, as women are advised to seek regular checkups. In today's special story, our reporter Cynthia Derito has prepared this explainer to further expound and elaborate on the topic.
Ovarian cyst medical condition is when solid or rather fluid-filled sacs form on the surface of the ovaries of a woman. They are also called cystic ovarian mass. This condition affects women between 20 to 40 years who are in their reproductive years. According to Dr. Kinuthe Njenga, who is an internal medicine specialist at St. Peter's and Anne's Hospital in Rwaka, said that this condition majorly occurs in young women.
Ovarian cyst is a condition that we see a lot, and especially, like you have said, in young people. We see them in young people because through puberty, all the way to when a woman goes through menopause, they go through hormonal changes. Every month they are going through their cycles, and through this cycle the hormones have to balance, and the hormones has to be in sync. You tend to see them in especially these people because then they are having some issues we call hormonal imbalance.
There are different types of ovarian cysts, which include functional cysts, which is the common cysts, benign neoplastic cysts, endometriosis cysts, malignant cysts, rupture, as well as ovarian torsion. Due to hormonal imbalance, ovarian cysts may trigger at most with the menstrual cycle. Menstrual cycle has three phases, which are follicular phase, which occurs from day 0 to day 10, the ovulatory phase, which occurs from day 10 to day 14, and the luteal phase that leads to the start of the menstruation flow.
If the menstrual period has three phases, from the day 0 to day 10, normally that one we'll call the follicular phase. This is when the body is competing for a dominant ovum to be released. Of course, we have the ovulatory phase. This is from day 10 to about day 14. And then the ritual phase is when, if there was no fertilization, then we'll lead to, of course, to the menstrual period. During this follicular phase, there are so many ovums, kind of eggs, that are really, competing. It is through this that sometimes some of them go mutation. And if they go mutation, the cyst will remain, but the egg inside will die. And in most women, in 6 months, they are gone.
In most cases, women tend to get ovarian cyst medical condition with no notice. It is therefore advisable to be on the lookout for the following signs and symptoms and seek medication. Some of the symptoms include pains in the back, pelvis, or side of the body, pain during sexual intercourse, as well as abdominal menstruation. Pelvic ultrasound is advisable so that the doctor or specialist can be able to tell how serious the condition is.
When you have a lady who's having issues with the hormones, pelvic pain, and all this, the test that you ideally want to do is the pelvic ultrasound. Pelvic ultrasound is a very benign. It does not have any radiation. A pregnant woman gets it. And so when you do an ultrasound, you'll normally find cysts that are within both ovaries.
Ovarian cyst rupture in other cases is when the sacs are filled with pus or water that causes bleeding. With no medication, ovarian cysts can lead to ovarian cancer due to the rapid growth of the cyst for a period of time. This might lead to problems with conceiving and pelvic pains.
An ovarian cyst rupture, it's very painful. And if you're evaluating a woman who has a ruptured ovarian cyst, then you tend to think of one, ectopic pregnancy. Has to be ruled out unless otherwise. If you do a urine or serum screening and you see that their BCG or the pregnancy test is negative, HSG, then it means it's not an ovarian, it's not a ruptured cyst. If now you are dealing with a ruptured cyst, a gynecologist, of course, has to be on board. If it's been, it seems like it's already ruptured and it's not bleeding, no problem. If it's bleeding, then they need an emergency surgery to go stop that bleed.
According to the National Center of Biotechnology Information, ovarian cysts affect about 7% of women at some point in their lives. Postmenopausal women have an ovarian cyst incidence of 18% over a 15-year period. Cynthia Derito, KUTV.
Thank you, Cynthia Derito, for that elaborate explainer. Now, moving on, residents in